24/7, I'm thinking about you. 20.
Hello po and good afternoon. Today is Sunday and we are having a special Q&A kasi po ang dami talagang humihingi ng libreng konsulta. So I'm Dr. Ana York Bondoc. Please join us live on YouTube and Facebook. And we are also accepting all your questions. Ilagay lang po sa baba. And we are happy po to answer any questions and concerns, especially po about the Omicron variant na 28,000 positive na po tayo ngayong araw na to. So a lot of people have sent questions. I hope we were able to pick up a few para mag-start na po tayo. So Miss Kat, Miss Reina, are you guys okay? A few updates lang po today. Ano po? Okay. Ready na kayo? Sige, konting update na lang. 28,000 nga po tayo ngayon. There are so many close contacts po and na na-isolate. The Department of Health has already said po na sa mga healthcare workers po, kung close contact po sila and that they are feeling very well and asymptomatic, may decision na po na i-lessen na po yung quarantine period. Actually, sa Medical City, ginawa na nga pong no quarantine necessary kasi po nakukulangan na po tayo ng mga essential services. Actually, sa PGH, 300 na po ang quarantined. So, dun sir, 300 workers who are quarantined. That includes doctors and nurses. So, pag naubusan po tayo ng mga doktor and nurse at lahat naka-quarantine, wala na pong magbabantay ng pasyente. So, again, we're appealing to everybody. If you are vaccinated, it will be mild. If you are not vaccinated, magpabakuna na po kayo. And please consult po with your doctor, lalo na po kung essential po kayo, nurse, doctor, working in a hospital, kung pwede pong i-shorten ang quarantine period nyo, kung close contact po kayo and you are feeling well. So, yun po yung mga positive updates ngayon po. Okay, so let's go with our first question. Again, before we start, nais ko lang pong sabihin that we are answering these questions in a general manner. It is still best to consult your doctor. If you are not feeling well, please go to the emergency room. And we are answering these questions po as a guide to all of us. Hindi po ito inyong personal konsulta, pero libreng konsulta po ito for our knowledge po. Okay? So, best consult your doctor pa rin po.
From Miss Maria Liza Tamayo. Hello, Doc. Kahit po ba may sipon, pwede pong magpa-booster? Salamat po.
This is an excellent question, Ma'am Liza Tamayo. If may nararamdaman po kayo, like you're having a cough, sinisipon, scratchy throat, ang una nyo pong dapat gawin is to isolate. Hindi po kailangan mag-test. Just isolate yourself for 10 days and stay there in your house, wag pong lumabas, and later na po yung inyong booster. Do not go po to the vaccination site kung tumutulo po yung sipon nyo or you have symptoms. Bakit po? Kasi po, likely, hindi ko naman sinabing 100%, pero likely po, meron po kayong COVID. So kung pupunta po kayo sa vac site, baka po kayo makahawa ng tao. So kung may symptoms, you stay at home lang po for 10 days. And if you're feeling completely okay after that, go po for your booster shot.
Okay, from Miss
Wait
Maria.
Wait lang. Sorry. Baka nininervyos po kayo that you are possibly positive. Tapos that's why you want to get a booster. Wag po kayo mag-alala. Your first 2 shots are still working. Okay? Don't panic na, I need to get a booster, I'm having a sipon. No. Your first 2 shots are still okay. The booster is just an added. So wag po kayo mag-panic. The fact na double vaccinated po kayo means a lot already. Ngayon po, pag okay na kayo, then that's the time you get your booster. Okay? I'm sorry to cut you off. Okay, go na talaga. Tapos na to.
Okay, from Miss Maria Teresa Carrera, how many months we had to wait from our second dose po, Doktora, para sa booster?
Thanks. Actually, no, before we used to wait 6 months. Ngayon po, for usually, 3 months na po ang sinasabi po ng gobyerno. And for J&J, it's possible na po na maging 2 months. May guide naman po, and you can ask po your LGU. They will also assist you po.
Konting ubo at may sipon. Salamat po sa sagot, Doktora.
Miss Rains, I'm sorry, I didn't hear the first part. Can you repeat it?
Okay, I'm sorry po, medyo bumababa yung internet connectivity namin. So, I'll repeat the question. From Ms. Sarah Jane Hipolito Tubig, ano pong mabisang gamot or home remedy sa makatiyang lalamunan? Konting ubo at may sipon. Salamat po sa sagot, Doktora.
Is this Sarah? Thank you, Sarah, for this question. The first step po talaga is to isolate yourself. Once you've isolated yourself, kayo po ba ay okay lang, like hindi naman gumagrabe, upon which we can do the home remedy po, no? Some people po like to gargle with salt for makating lalamunan. Yung iba po, you can also purchase po yung mga commercial gargles like povidone iodine, ganun po, to help your throat feel better. But some people po, maligamgam na tubig with asin, okay na sila. Some people use strepsils also. All of those are okay. But remember, if you're not getting better or if tumataas ang lagnat, then it's good also to have a consult po with your doctor. Meanwhile, isolate and use the maligamgam na tubig with asin. Do not drink, gargle.
Okay, from Miss Mary Jane Ladra. Hello, Doctor. Ask ko lang po, booster ang nag-take ng TB med? Mas na akong nakakapag-take po. Salamat po.
What about the booster and the TB meds? Can you take a booster shot when you have TB meds? Ganun ba?
Yes daw po, Doktor. Nag-take daw po siya ng TB meds.
Yes, ma'am, thank you so much. Yes, you can take a booster shot or any vaccine po, first shot, second shot ng COVID vaccine, if you're taking po anti-TB medicines. Sana lang po, wag po kayo actively umuubo, no? Kasi baka mahawa po yung vax center. But normally po, no, if a patient with active tuberculosis takes medicines po for 2 weeks, tinatawag na po namin yung sterilized. Ano meaning po nun? Hindi na po nakakahawa yung taong yon. So wear a mask and go po to the vaccine center for your booster. Thank you.
Okay, from Miss Catherine Manalili. Hello po, Doc. Kailan po ba dapat bigyan or uminom ng antibiotics ang inuubo po? Salamat po.
This is actually a very good question. And yung ano po nito, marami pong nagdedebate po talaga dito. Sa akin, no, I do not start antibiotics immediately. Lalo na po if it is a viral infection. Kasi most of ubo and sipon is actually viral. In this case, the COVID is a virus. So yung antibiotic po talaga is not the solution po for COVID. Because COVID is a virus and yung antibiotic po is against bacterial causes. Kaya lang, it is very common po talaga for persons to want to take antibiotics and ninenervyos, okay? My advice, ganito po. Try to see a few days. Excuse me po, talagang dami ko na kong kina-counsel sa telepono, wala na akong boses. Wait for a few days, no? Kung nagpa-persist po yung lagnat, nagiging yellow po yung plema, then it's okay to start antibiotics under the supervision po of your doctor. Don't do it yourself.
From Mr. Vino Villanueva Sesky, good PM Doktora, ask ko lang po, anong pwedeng inumin na gamot para sa ubo ko? Sobrang kati ng lalamunan ko, sobrang higpit pa po. Masakit na leeg ko, kakaubo, Doktora. Salamat po.
Cough syrup po. You can take over-the-counter cough syrups, over-the-counter po na decongestants. And kung may lagnat or if you're having lots of body aches, paracetamol po. But again, if you are not getting better or if you think you are getting worse or may edad na po kayo or marami po kayo sakit like asthma, diabetes, dialysis, it's good also to consult your doctor. For the scratchy throat, I already said po, no, yung mga gargling with maligamgam with asin, or you can use the commercial preparations like povidone iodine, Bactidol, yun po yun. Betadine, pwede rin po gargle. By the way, I'm not being paid by any drug company, so okay lang magbanggit.
From Mr. Noel Magat-Gatdula, good PM po, Doktora. Itatanong ko lang po kung kahit may trangkaso at inuubo at sipon, pwede po ba akong magpa-vaccine? Pakisagot na lang po. Bukas na po kasi yung schedule namin. Thanks po.
Naku, sir. If you are may nararamdaman, you need to isolate. So you cannot go to the vaccination center. Kasi po, baka may mahawa po doon. So what you should do po is wait for 10 days. Siguro kung kilala niyo po yung vaccine, like yung barangay captain nyo, sabihin nyo muna, wag muna, ganon. And then, stay there in your house for 10 days. Pag tapos na po yung nararamdaman nyo, pa-reschedule po si bakuna. But again, congratulations po for scheduling your bakuna. And hopefully po, I don't know kung first dose, second dose, or third dose. Pero kung first dose ho, tapos magpapa-second dose kayo, meron naman ho kayong antibodies na po. Do not worry.
From Ms. Marivic Temporada, ilang months po ba bago magpa-booster, Doc?
Ay, ma'am, normally 3. 3 ang advisory po sa Pilipinas, J&J 2.
From Ms. Arlene Esquibel, good afternoon po, Doktora. Praise be Jesus and Mary. Ask ko lang po kung ano po yung safe na P1% sa pulse oximeter. Ano pong masasabi nyo sa oxygen in can? Makakatulong po ba ito in case of emergency? Salamat po.
Hi, Ma'am Arlene. I have a video on the pulse oximeter. Paki-repost na lang, Miss Reyna, para mag-guide yung mga tao. Yeah, paki-repost na lang uli. Siguro ipipin to top ko na lang yan or something like that para makita po ng mga tao. It's a TikTok video actually, which had 800,000 views. So ilalagay po namin uli. Can you use oxygen in can? Meron pong you can buy oxygen po. Usually nakakanister po yun. Yung malaki. Again, I have a video for that. Opo. You can use that.
From Miss May Lopez Mercado, kagagaling ko lang po sa trangkaso.
Ay, wait lang. Sorry. Balikan po natin, the O2 sat is usually 93 and above is okay. Kung may edad po kayo and you have many problems with your heart, siguro tingnan lang po natin yung 95. Kung hindi nyo na po nakakayanan si 95, call your doctor. Kung healthy naman po, 93 to 95 is okay. Another thing po sa pulse oximeter, you can check po, you can go up the stairs. Kung talagang sobrang bumababa po, when you go up the stairs, may problem din po yan. And again, kung bumababa po yung pulse oximeter nyo, you need to call up your doctor. Wag ho kayo yung magdesisyon lang na kayo na mag-oxygen. Ay, may oxygen lang ako dito, I'll just stay here. Hindi po ganon. Yes, you can get the oxygen, but you need to inform po your doctor na you are going to start using oxygen.
From Miss May Lopez Mercado, kagagaling ko lang po sa trangkaso. Pwede na po ba akong magpa-booster?
Yes, ma'am. If you have had 10 days po and you feel totally okay, you can have a booster shot.
From Miss Marites Gonzalez Bunag, Doc, good PM po. Need po ba ng antibiotics sa may mga tonsillitis?
Are we talking about the situation that's going on ngayon or just a regular tonsillitis? Ilagay na lang siguro natin sa sitwasyon ngayon, ano po. Kung nangangati po yung lalamunan nyo, normally I would not give antibiotics. Hindi talaga ako mahilig. And even if that's COVID, the antibiotic is not the gamot for COVID. So ako, I would wait for a few days at kung hindi talaga getting better, then consult your doctor po regarding antibiotics.
From Miss Jeng Yabut Bustos, Doktora, ask ko lang po, kung pwede na ako magpa-flu shot tapos na po ako magpa-booster.
Yes, ma'am, you can have a flu shot. Have some, like mga 1 week or 2 weeks between the flu shot and the booster shot.
From Miss Eileen Malones Santiago, pwede po ba ipa-booster ang Pfizer kahit po may asthma? Janssen po ang bakuna ko.
Yes, it's possible po. Again, you may want to consult po yung doctor nyo regarding po yung asthma nyo. Pero kung tahimik lang po yung asthma nyo, yes, pa-booster na po. Actually, it's the LGU naman po that's gonna decide upon the booster shot. Tatawagin po kayo. Ang advice ko po, pag tinawag kayo, go na.
From Miss Mary Vic Temporaza, hello po, Doc. Nanay ko po, di pa nagpa-vaccine kasi po may hika po siya. May maintenance po siya at nervyosa po.
Ma'am, pabakunan nyo na yung nanay nyo. Can you imagine po kung ano yung magiging nervyos nyo lahat pag na-positive si nanay? Baka ho tumigil yung puso nyo sa nervyos. So, the nervyos po that you will feel from the vaccine, super liit lang po. Halimbawa, nakaharap nyo na po si Doc at sinabing, positive po si nanay at walang bakuna. Baka kung may, I can't. If that happened to me, baka mahimatay po ako. So, pero kung sinabihan akong positive ako at may bakuna ako, kalmado lang po ako. So yes, we cannot force anybody po talaga. Kaya lang, sana pag-usapan po nyo ni Mami na talaga pong there's lots of benefits to being vaccinated. And you know what? Ang Metro Manila po, I just read this, 106% daw ang vaccination rate ng Metro Manila, Reyna. So what does that mean, it means na maraming pumasok sa Metro Manila na nagpabakuna na hindi tiga rito. Maybe because they're from the province, they want to be vaccinated. So my question to you is, kung 100% na ng Metro Manila or a really, really big percentage nagpabakuna at buhay pa po sila ngayon, then I guess it's safe. Kasi wag nyo lang ho akong pakinggan eh. How about we see po, buhay pa ho ba yung mga kamag-anak yung nagpabakuna? How about yung ibang kabarangay nyo? Kasi the vaccination is ongoing eh. So lahat po tayo ngayon, we know somebody who got vaccinated. Ang tanong ko, are they okay? If they're okay, then take courage from that.
From Miss Elise Castro, pwede po ba magpa-vaccine ng 2.7 lang ang potassium level ng 17 years old?
Bakit hindi niyo pataasin yung potassium level niya at ano po ang kanyang sakit? My best advice for you, magpatingin po muna before you get vaccinated. But if this is a kidney problem, kasi most of the potassium comes from kidney problems po, siguro naman may nephrologist po ito, no? Pa-check up po muna kayo doon. But if this is a kidney problem, pangkalahatang advice lang ha, it is kasama po kayo sa comorbidities. In other words, pag na-COVID po kayo, kasi hindi naman natin alam kung Delta o Omicron po yung tatama sa inyo, it is potentially serious. So yes, get a checkup and get vaccinated po.
From Miss Reynan de Ramos, Mr. Reynan de Ramos, Doktora, nagkasakit po ako sa baga, nagamot na. Kaya lang nung last na nagpa-x-ray po ako, may nakita na naman. Pwede po kaya ako magpa-vaccine? Kasi gusto ko na po magpa-vaccine.
That is good po. I would like to congratulate you for that attitude. Active TB po, are we talking about active TB or are we talking po of lung cancer? Hindi ko rin po alam. ang best advice ko po sa inyo, balikan niyo po yung doktor niyo. I think someone is giving you medication, tama ba ako? Balikan niyo po and get a clearance. And yes, kailangan niyo pong magpabakuna as soon as possible. Kasi po, may findings kayo sa lungs eh. So, napapasok na po kayo sa comorbidities. At kayo po ang vulnerable. So yes, get a checkup and then get vaccinated po. Kung sabi po ni Doc, okay.
Okay po. From Miss Lulu Casal, kung may lagnat po ba, pwede po bang magpa-booster?
Hindi po pwede kasi hindi po kayo i-allow dun sa vaccine site. Kasi po, there is a checklist before you go inside. Nakalagay, are you in close contact with someone who became positive? Kayo po ba ay may simptomas ng COVID? Ito po yung lagnat, sipon, ubo. So kung may lagnat po kayo, you will, tapos kukunin po yung temperature nyo, hindi po kayo papapasukin doon. Kasi po, if you are indeed with COVID at hindi ko sinabing may COVID po kayo, baka humahawaan yung vaccination site. My best advice, stay home muna for 10 days, uminom po muna ng mga over-the-counter drugs like paracetamol, and then go back po for your booster shot.
From Miss Annalyn Alcedo Benito, Doktora, grabe po yung ubo ko, halos di ako patulugin. Ano pong pwedeng gawin or gamot habang hindi ako makalabas ng bahay kasi naka-isolate?
Ma'am, I am also concerned po na sumusobra na po yung grabe ng ubo nyo that you cannot sleep. I would suggest po that you try over-the-counter cough medicines like Nagundi, Ambroxol, Dextromethorphan, lahat po yan, ano. But, if it's not getting better, it's time for a checkup.
From Miss Vanessa Pagador, ano pong gamot ang pwede sa namamagang tenga? Nilalagnat po ako ngayon dahil sa tenga ko po. Salamat po. God bless po.
Ma'am, check up. I don't want to tell you that you have otitis mean. Hindi ko alam kasi kung looban or labasan. Check up po ang sagot po dyan.
Next po, from Miss Edna Bonifacio Bismonte. Good day, Doc. Ask ko po, ilang months ko pwede magpa-vaccine ibang vaccine? Example, anti-flu.
After 2 weeks po of your last vaccine, it's okay to have an anti-flu. Actually, wala naman talagang timing, ano. Kaya lang ako po, hinihiwalay ko po yung dalawang bakuna kasi I want to give you time to recover from your COVID vaccine. Kung may side effects man, majority naman talaga hindi. Pero wala naman pong masama to wait for 2 weeks.
From Miss Marivic Temporaza. Good day po, Doc. Nanay ko po di pa po nagpapavaccine kasi po may hika po siya at may maintenance na gamot. Pwede po ba siya magpa-vaccine at ano pong pwede sa kanya? Salamat po. God bless po, Doc.
Ma'am, this is not personal to ma'am or your mommy, okay? Pero yung sinasabi po na hindi pa po nagpabakuna dahil may nararamdaman na high blood or diabetes or dialysis, ma'am, mas lalo pa po ngang dapat magpabakuna yung mga tao pong may sakit, stroke, thyroid, lahat ng sakit, cancer, ganon. Bakit po, no? Kasi po, kung itong mga taon to na marami na ngang sakit, itamaan pa ho ng isa pang sakit, hindi po maganda yung mangyayari. Kasi parang ang dami mo ng dala na sakit, tapos mababatuhan ka pa ng COVID, hindi mo na kaya yon. So please, mas lalo pa pong dapat bakunahan ang mga taong may karamdaman na. And this is called A3, no? Comorbidities po. In fact, inuna po kayo ng gobyerno. It's already been more than 6 months. Siguro po, okay na po yung timing na pinaunan nyo na po lahat ng tao. Ang dami pong na high blood na nabakunahan, buhay pa po sila. And dami po. Ako, I personally vaccinated my cousin who's having cancer po and nagpapakimo. She remains, fighting her cancer po, no? So, siguro po, ang worry nyo na lang talaga is really the nervyos. And I really appeal to everybody, isipin nyo po yung magiging nervyos ng pamilya nyo pag hindi po bakunado, na senior pa, na marami pang sakit, ang na-COVID or na-positive, talagang, Diyos ko, baka magkagulo po kayo sa bahay nyo. Again, no, more than 50% of the Philippines is already vaccinated. wala naman hong namatay na katakot-takot na karami-rami. Otherwise, talagang iti-TV patrol po lahat ng namatay na yun. So, really, lakasan na lang po yun ng loob. Number 2, talk to your mga relatives, close friends, Facebook friends na nakita nyo pong nabakunahan. And then, number 3 po, any bakuna naman po is okay. As long as mabakunahan po kayo. And number 4, kung nagwo-worry po kayo, at hindi ko naman ho matatanggal, syempre nanay niyo yun, ano? May karapatan kayong lahat to worry. Kung nagwo-worry po kayo, then a check-up with your mom's doctor would be the best po. Okay? So, kaya nyo yan. Nakayanan po namin lahat yan. Kaya nyo rin po. Okay?
From Miss Mary Fe Amar, Doc, good PM, yung friend ko may Hep B. Pwede pa vaccine? Thanks po. God bless.
Yes, it's actually hepatitis. It's hepatitis B month. So yes, you can get vaccinated. One of the most prominent liver doctors in the Philippines, si Dr. Janus Ong, was my guest, and he made a personal appeal po sa mga may hepatitis na magpabakuna po sila. So yes, the answer is yes.
From Miss, okay, next. From Miss May
Okay,
Lopez.
ako naman yung tanong, ako muna magtatanong. Marami bang tanong? Or
Doc,
we're
yes
going to
po,
the
yun
end
lang
na?
tayo. Yeah, not yet. Madami pong tanong, so mag-last 2 questions na lang po tayo.
Yeah, last 2 questions na po tayo. Thank you, Miss Rina.
From Miss Girly Bautista, Doc, positive po ako sa COVID-19. Sobrang sakit po ng lalamunan ko. Ano po kaya ang pwedeng gamot? Di na po tumatalabang gargle ng Bactidol and warm water with salt.
Ma'am, my question to you, there are 2 things. Are you vaccinated or are you not vaccinated? If you are vaccinated po, malaking talagang na you will be mild lang po. Ngayon, if the Bactidol and all is not working, then it's time po to go to a consult po sa doktor nyo. Kausapin nyo po. Ngayon, if you are not vaccinated, talagang problema po yan because the Omicron is mild for the bakunado. For the hindi po bakunado, pwede pong hindi mild ng Omicron. So again, consult your doctor. If it's not working, ito po kung hindi po kayo gumagaling from the over-the-counter and mga home remedies, kung sa tingin nyo po grumagrabe, then it's time to see your doctor po. Do not wait until hingal na po kayo. Call up na kaagad the doctor. Okay?
Okay, last question for today from Miss
Okay.
Mena Malakugan. Pwede po bang magpa-booster kapag nag-positive sa antigen test?
Ma'am, no. You need to isolate yourself for 10 days. Hindi po talaga. Kasi pag nag-positive po kayo sa antigen test, likely positive na po talaga kayo, no? So, you need to stay at home for 10 days kasi po isolation ang tawag sa inyo and quarantine. Opo. But don't worry. After the 10 days, if you feel okay, booster na po on day 11. So to everyone, thanks Miss Rina for helping us. Thank you Miss Kat. Sa inyo pong lahat, it's a very worrying weekend. But you know what? As long as you're vaccinated and then you can stay at home, recover slowly and rest. All right? And again, mask, social distancing. Ako nga double mask ngayon malapit na rin akong naka-face shield na nga ako last week. So lahat po 'yon will help us to malipasan po itong Omicron. But the most important po talaga, and I can't emphasize this enough, magpabakuna po sila. Okay? Thanks and have a good weekend.